Welcome to Taiwan.
Thank you. Nice to meet you.
I am the president of the Taiwan T-Sops.
Really? Thank you. Hi. Thank you very much for inviting me. I can say hello, you Taiwanese doctor. I'm very glad to meet you.
Dr. King, welcome to Taiwan. Thanks for Dr. King to be invited to Taiwan.
Thank
our
you.
T-Sops to present a speech in our fall conference.
Yeah, honor.
First, I will tell about the audience how I met Dr. King. About 6 years ago, my colleague Dr. Tsai and Dr. Liao and me, we visited Dr. King's clinic in Insang, the Hawkins Plastic Surgery Clinic. And we also observed your surgery. Very wonderful, the operation in your clinic. Then I come back to Taiwan, I also read a lot about your medical paper. I feel such touching about Dr. King's viewpoint, about your viewpoint about the brain pharmacoplasty. It's such detail, which I feel question you told us a lot and teaching us a lot. So very thanks again. So now I have 3 questions to ask the Dr. King for me and for the Taiwan eyelid surgeon. We know the plastic surgery is very famous in whole world. So I wanted to ask the Dr. King, what's your trend in Korea about the brain pharmacoplasty?
Okay. Nowadays, many people live in the Asian country come together to take a surgery for me. They have already big eye and already big fold and outward fold, but they want to be like a Korean actress eye. So she wants reduce their fold height. So I usually do the reducing surgery of eyelid. So this is the situation of these days. So the Korean style is in fashion these days. So back in the 1970s or 1980s, the trend of Korean eyelid surgery is tended to follow the Westerners. So the fold height is very high and deep and medially outfolded, but not fit the Asian face. So in these days, the Korean people want to be their eyes looking bigger, but her eye fold should be small and shallow, and inward fold is looking natural. So they want to be like a Korean actress. So in this, the trend of these days in Korean surgery style is making a bigger eye with a small and definitely shallow fold. Yes.
I think in Taiwan recently maybe within after the COVID, the trend like Korea.
Oh, really?
Before the patient, the customer asked us to do the bigger eye, like the mainland China actress, the Fan Bingbing. But right now, they ask us to do the actress in Korea, like the Blackpink.
Blackpink, okay.
The second question for the Dr. King is we know the aesthetic competence is very important for plastic surgery. So, Dr. King, what's in your heart? What's the beautiful eyes in your heart?
In my personal opinion, the beautiful eyes consist of 3 elements. The first is eye shape. Shape means the concave shape. And the second is the balance. And the third is double fold. So I explain more. The shape is wider, is more beautiful or more younger. As you know, the almond, not the almond, the almond shape is the most attractive and the most beautiful eye shape. And as for the balance, I think the pupil has to expose 90 or 95% is good, and the medial scleral triangle and the lateral scleral triangle, the area is similar, we can say the balanced line. And intercanthal distance in Asia is evenly the third divided into third. As well and Caucasian, the intercanthal distance is more narrow. And double fold in Asia, I think the fold size is adequately, but the small is more good than the large. So in Asian, people have the intercanthal fold, so I think the inward fold is more good and more fit to their face. So I think the three elements has a neutral eye composition.
Yeah.
This is my thing.
We know the lure of the evaluation and the adjustment is the key point for the operation success. Yeah. So I'm wondering about the ideal concept for the plastic surgery for Dr. Keith.
Okay. It's a very complicated and difficult question. But if I say the answer, in order to analyze patient situation and perform adequate surgery appropriate for that situation can give the patient satisfaction. So sometimes patients have some abnormal expectation, excessive expectation should be fully explained by surgeon, and so they can have a sense of reality. And then, as you said just before, we doctors have to increase our aesthetic sense and improve our performing surgery well. It's also very important. And most important is the detailed observation. Having insight before surgery is very important. So, how detailed the direction, how can we operate well to the patient? This can give the patient satisfaction also. And one more thing, in secondary case, we have to consider two things. The first is aesthetic improvement. The second is functional aspect.
Functional aspect. Eye health.
Yes. So, such as pain or discomfort or dry eye like this. So we have to consider the functional problems. Yes.
Because in my experience, when I go to the Korea conference, sometimes I'm wondering in Korea the plastic surgeon, is familiar for the eye condition. Yeah, because we are the ophthalmologists, we care the eye health. But we wondering what's the Korean doctor, plastic surgeon so familiar with the eye health? It's my wow, yeah. So I think the health and the functional and you mean the aesthetic, two components.
Yes.
Of course. Thank you, Dr. K's question, and we are looking for the